If you're experiencing what we call mechanical pain, and that means pain being up on your feet, standing, walking, bending, you might have a problem that you would need a lumbar fusion for. So pain after a lumbar fusion is going to be there. It's probably going to be a fair amount of back pain. You might even have some nerve pain, but most of the time it's going to be that muscular pain because of the distraction of the muscles and the just cutting through the muscle. You're going to need muscle relaxers. You're going to need pain medication. And while you're in the hospital, you'll need IV pain medicine. That works quicker. It's a little bit stronger, but you can't go home on that. So over the course of the first day or two, we're going to try to get you off the IV pain medicine. But I would expect that most of the patients with a lumbar fusion are going to need some pain medicine probably 2 to 3 weeks after surgery. And they might need their muscle relaxers as long as six weeks. We don't usually like to use a lot of anti-inflammatories after a fusion just because that can interfere with the way the bone fuses. So we can't use things like ibuprofen or Aleve, which sometimes can help with pain, but in this case, that's not recommended. So if you're looking at having a lumbar fusion, the things that you can do, if you can, with your symptoms, are try to strengthen your core. If you can exercise, getting that core strong is going to be better, but unfortunately a lot of our patients can't do that. Stop smoking. That's 100% the best thing you can do for your spine going into this surgery. And a lot of our insurance payers are starting to require that. And some of the insurances are even nicotine testing people before surgery because they know that people are going to do better with not smoking. You're going to heal faster, your incision will heal faster, and the bone will heal faster. Nicotine interferes with our bone growth, so that makes us less likely to heal a fusion. Also, if your blood sugar is not controlled, that's going to interfere with your fusion as well. You need to get your osteoporosis or osteopenia treated if you're looking at a lumbar fusion because not treating your bone density will make it harder to fuse. A lumbar fusion is a big deal, but there are a lot of things you can do leading up to surgery to make your recovery easier. If you're carrying around some extra weight and you can lose that, that would be good. If you can stop smoking, control your diabetes, get your osteoporosis or your osteopenia adequately treated, all of those things are going to make the bone fuse and make you heal faster. So once you get home from your fusion, you're going to take it easy. You're going to not lift anything more than 5 or 10 pounds. You don't want to bend more than to wash your face, brush your teeth. You're probably going to need help the first couple of days, getting into the shower, getting your clothes on. But after the first couple of days, you'll probably be able to do things like that independently. You're going to need someone to do the cooking for you. Maybe you've made some meals before your surgery. That's a good idea to do too. You'll need someone to do your laundry, the sweeping, the mopping, the taking out the trash. So, think about all this beforehand and then make sure you have that lined up for afterwards. You're going to want to get up. Probably when you are first home, you're going to want to try to get up and walk around during the day about every hour. You don't want to sit in one place too long. You don't want to just go to bed and stay in bed. But you'll need naps during the day too, and that's okay. So you just want to sit a little, lay a little, walk a little, and your walking will get better day by day. It's possible that you will have a home physical therapist come in. They can help you get your home arranged so that it's safer, not having rugs that you might trip over or cords that you might trip over, and they can instruct you in some gentle exercise that you can do until your 4 weeks is up. It is very important for you to take it easy when you get home. Walking is fine. You want to gradually increase that walking week to week. Frequent short walks are way better than taking a long walk and then not being able to walk for several days. But the things we don't want you to do are yard work, weed eating, getting on your tractor. Those are things that if you do that too soon, you could have a setback, and that setback, unfortunately, could really set you back.